everybody. Good morning, good afternoon, good evening. Well, I guess it all depends when you're watching this video. This is Dr. Angelina with Surgicare Arts and IBI Healthcare Institute. I decided to take some time to make some videos for you to watch before you come in for the consultation. And also you can use it if you already had a consultation and you had some more questions, you can rewatch the video to remind yourself about what we talked about. Reason I'm doing it because I've just been informed that to get on my schedule, even for telemed appointment, it sometimes takes a few weeks. And of course, we have a limit how many patients we can see each day. And a lot of time we kind of repeat very similar things, what's gonna happen, what to expect, how surgery is gonna go. I figured if we have this information ahead of time, you will come in a little bit better informed about our process. And that way you can just ask more relevant questions rather than getting a lecture from me or one of my assistants every time. That's gonna help you with overall process. When you come in for consultation, whether it's telemed, which is like the video consultation for people who are from out of town, or you come in person, generally, you have to fill out some paperwork. If you're doing telemed, we don't make you do paperwork at that moment, but when eventually you do come in person, you'll fill out that paperwork too, regular doctor stuff. Then, one of our assistants or me will ask you for detailed medical history. I'm saying that because it's common sense when you come to doctor's office. However, somehow people sometimes forget that cosmetic surgery doctors are doctors too, but we do need a detailed medical history. So that's gonna be one of the first things you're gonna be asked about. And I don't care if you're coming for fillers and Botox or you're coming for big operation consultation, we're gonna need to know the history. Basics, previous medical history, like what do you think you have, right? Major surgeries or minor surgeries in the past. If you're coming for filler and Botox, have you had them before? Implants, medical conditions like heart attacks and blood pressure and diabetes, right? We need to know all of that information. If you have scars somewhere, I need to know where they're from and what they're doing there. Allergies to medications, allergies to latex or any other funky stuff. Medications, I would like for you to know your medications. What are you taking now? What you stopped taking? What's the history? Family history, sometimes we ask that too. Well, we ask everybody, but if there's any major medical problems, especially problems with anesthesia, problem with heart attacks, diabetes, we need to know. Any psychiatric mental problems, very important. That's in the cosmetic surgery and weight loss surgery world, I think it's even more important than other stuff. If I was taking emergency appendix, I would not care as much because, well, we gotta do it. With more elective surgeries, especially ones that are gonna change your body image, potentially change your weight, like with the weight loss surgery, how you look and how you feel, those are very important things and they do affect us psychologically. So we need to know if there's another medical condition, because psychiatric conditions and psychological conditions are medical conditions in my mind. We need to know because we can get you ready appropriately. Same thing with diabetes. High diabetes numbers, we need to know because healing will be affected. If you're a smoker, I need to know. If there are use of drugs, cannabis or whatever, vaping, I need to know. Once all of that is done, then we would want to know exactly what are we consulting you for. What are your things that you're trying to improve? So if it's mommy makeover, we're going to talk about your breast or body or urinary incontinence or vaginal tightening. I don't care. We'll go into that issue during consultation so you can get in a little bit more detail of what's happening. Then, once we decide what we're going to do, we'll also talk about the day of surgery and how it's done. Those important questions to have answers to. Number one, we operate out of certified surgery centers. They're outpatient surgery centers. It's not inside the hospital. We don't have to go to hospital unless there's some major emergency, which is quite rare. And we do have hospitals nearby that we have privileges in. So doctors have to have privileges to go to a hospital in order to treat patients. We cannot just walk to any hospital. All my doctors, all our providers have privileges in nearby hospitals for emergencies or in case we're operating there. But for cosmetic surgery, we're operating in outpatient surgery centers. That means you go home the same day. You're gonna come back in most cases next day to see me and my team so we can check on you. And if we have long incisions like breast lift or tummy tuck or facelift, I put you in hyperbaric oxygen chamber. Most of the time, one time is enough. It just gives you a little bit of energy, gives you a little bit more oxygen to your wounds to help them heal. But that's something I do just like a little extra to improve overall feeling. Then, based on surgery, if it's breast surgery, we would see you day 1 after surgery. Then we will see you 1 week after, 3 weeks after, 6 weeks after, and so on. So we see you several times after surgery. And of course, there's any problem in between, my patients know they can call us, email us, send us a message, or just walk into the office in case they're not sure if something is weird. So I make it very kind of strong point that I do want to know if there's a problem, and I don't want you to wait until 5 p.m. Friday evening to tell me about the problem. I want to know as soon as you think there's a problem or maybe a problem, because I would want to evaluate it before the weekend starts. We're not going to want to sit on it. Next, if we're talking about tummy tucks, same thing. It's outpatient surgery procedure. We're going to get it done, and then we're going to send you home. It's a longer surgery, so I use special things like Exparel, so you can look up that medicine. Exparel is an injectable medicine that I do during surgery. So during procedure while you're asleep, I actually inject your nerves with that medicine, kind of like a dental block. When you go to a dentist, they give you 1 shot and half of your face is numb. Exparel is kind of similar medicine, except for whatever we inject it to. So in this case, belly. Instead of 2 hours like a dentist, this block lasts 48 to 72 hours. So much longer acting medicine. Really, really good for helping you getting up and walking around after surgery. I expect you to be up on your feet day 0. In that recovery room, I would want you to walk to the bathroom with help, but walking. Next day at home, every hour while awake for any surgery, you need to be getting up and walking. We're not doing the whole couch potato thing. You come back next day, doesn't matter which surgery you had, we check you out, make sure everything's good. If you have drains, like for tummy tuck, most of the time they're drains. You'll come back day 5, day 10 to remove those drains. It does not hurt. That's the most common question. Is it gonna hurt? I can't think. It's not gonna hurt. It doesn't hurt to remove the drain. It might be annoying while it's in for you because it's kind of like there. It might be pulling you a little bit. It doesn't hurt when it comes out. Actually gives you a lot of relief because now that little annoying thing that's sticking out of you is gone. So those kind of like basics overview of what usually happens. Little extras that we do like Exparel and hyperbaric oxygen chamber. Some patients, if I feel like before surgery, you need to lose some weight, which a lot of us do, or at least help maintaining the weight that you already got to yourself. I want to make sure we're kind of closer to our happy weight as much as we can. We have medical weight loss programs that we can start you on at the office during your visit to help you maintain or lose weight. If we need to lose a little bit extra, we do have procedures for weight loss, or bear balloon, endoscopic sleeve, laparoscopic sleeve, gastric bypass. Those procedures need to be in the back of our mind for people whose BMI is more than 35. We have to discuss them. We don't have to make a decision right that second, but that's something I will bring up if I feel like person need to lose some weight to get to healthy weight. I don't say no to patients. A lot of patients will call in and say, do you see patients with BMI over 35, body mass index? I never would say no, because even if I cannot do tummy tuck on you right now, I can have a doctor in my practice offer you other services to help you get to a goal weight or happy weight that's usually below BMI of 35 for most people. Why? Because we know BMI of over 35 will cause more medical problems going forward, even if you don't have any right now. We're really trying to help all our patients to treat patient as a patient and not just as a tummy tuck or as just a breast lift. So really trying to, treat people like people. I hope this little lecture helps with the beginning of a consultation. Once we do the consultation, when you come in person or in telemed, I will ask you to unrobe so I can take a look. If we're doing breast, I will do some measurements with the tape measurement, where your nipples are, how far away they are from each other, how long do they go, where do we want them to be. We'll discuss your breast size currently or where you want to be size-wise comparing to your body size. Same thing for the bottom area. When we're talking about your belly, I'll have you walk around so I can see the front and the back to determine if we need some liposuction, maybe lipo 360 while we're doing tummy tuck. It's possible. We'll look, as I said, at all the scars, see where the fupa is, because unlike a lot of people who somehow sell those things separately, tummy tuck includes Mons lift, it includes muscle repair, the diastasis repair, and skin removal. So those are not like 3 different surgeries that somehow we do you a favor and put together. Those things are part of the same procedure, and you cannot really separate them because it just makes no sense. The whole point of tummy tuck is to put your muscles back together. And when you're cutting out the extra skin, you're not really supposed to leave half of your fupa behind hanging. So if that's an issue, it has to be addressed at the same time. Liposuction is optional for most people, obviously. However, that's where the weight issue comes in. If somebody has a little extra fluff right there in the middle section, I cannot make a flat belly out of it unless I go in there and liposuction it, or we do a little weight loss first and then do some liposuction to flatten out the belly, the skin, to lay down nice and smooth, to hopefully achieve the look that you're trying to imagine for yourself. Last thing I want to do is make big, major surgery, and then you would realize this is absolutely not what you imagined and you didn't get the flat belly that you wanted. That's why a lot of times we'll go take a step back and try to start from the beginning. Happy weight, get to where you want to be, get you ready for surgery, then do the surgery one time and not redo it every other year. If you have any questions, our office email info@surgicarearts.com. We are on Instagram at surgicarearts and Facebook at surgicarearts. Our YouTube channel is here, which is IBI Healthcare. It's part of our combined corporation, which includes IBI Healthcare Institute and Surgicare Arts. And TikTok, Real Dr. Runway. If you have any questions, you can get hold of us all the way there. And of course, you can call us. The numbers will be in the link. I think that's a good start. Hope this helps, and I'll see you at the consultation. Thank you.